You're listening to the UAE's #1 talk radio station.
This is The Agenda with Georgia Tolley
On Dubai Eye 103.8.
Research shows that UAE obesity rates could reach 95% by 2050. That is the highest globally. Now, we covered obesity before on the programme, and usually it's because the government's introducing, a policy like a national task force or something. But I wanted to know, what type of impact these policies are having, these initiatives are having. So to discuss the local impact, I spoke to Dr. Hussam Mohammed Altrabulsi. Now, he's a bariatric surgeon at Medcare. And I asked if he was already seeing these dramatic figures reflected in his clinic.
I think those numbers are a bit higher than my knowledge, but it's close enough. So this is really an alarming number. For now, I think it's around 30% of the people living in UAE are suffering from obesity.
I mean, this is a health crisis waiting to happen. And clearly, we're talking about individuals who are children at the moment. Are you seeing young children coming through your clinic who are already obese in the UAE?
Yes. You will be shocked because children as little as 10 years coming with a BMI of 40 or 45 or 42. And this has a huge impact on those children's well-being. We are talking physically and psychologically. Can you imagine somebody who's having at least 30 kilo of extra weight and go to school with other children? It's really a nightmare for them.
It must be awful. And I know ultimately it comes down to parents' responsibility and educating parents. But is the government getting involved with policies and initiatives?
Yes, UAE government is trying. You know that economic burden of obesity for the government is around 10 billion dirhams annually. So this is a huge number. So I think there is a couple of initiatives from the government. There is the national program to combat obesity among children and adolescents. And this is targeting children between age 5 and 17. And the aim is to reduce this rate to 12%. There is also a training workshop in all schools, I think in all government schools, that a workshop dedicated to children and their parents on obesity, on their problems, how to tackle this, how to monitor your children. And I think there is in Abu Dhabi also one weight management program through the Department of Health in Abu Dhabi. Also, it's focusing on children because once you have obesity in your childhood, it's very difficult to treat it once you are adults. And I think there is also trying to put some more taxes on sugary drink. It's called sugary drink tax. They are increasing it by 50% tax on these drinks. So hopefully all of this will have an influence that we could see on ground.
Can I ask you, I hope this doesn't come across as a sort of naughty question, but what do you say to parents who bring their children into your clinic and their children have got that overweight? Do you have those slightly hard-hitting conversations that need to be said? I mean, maybe I'm being a bit unfair.
No, let's be very clear about this. One of the main components of obesity in children is genetics. So you can't blame the parents or children for genetic things. But there is some number of those children are suffering it because of lack of care from their parents. Nobody is following up. They are allowed to take chocolate, sweets, fizzy drinks, high sugary drinks every day. Yes, we always have a clear and open conversation. You cannot just blame, otherwise it will be just throwing the ball into their courtyard without giving them help. So basically, we need to approach it scientifically. We need to see the family trend. We need to do the blood test, making sure that there is no endocrine issues and problems. And then, yes, we have our brilliant dietitian who will be always a part of this system to assess the children eating habits, try to help the parents to find a solution, to really plan for the future for those. But the results usually are slow. So we are talking about at least 6 months plan just to see a result on those children.
That is Dr. Hussam Mohammed Altrabulsi. He's a bariatric surgeon at Medcare, and it was really interesting to hear about, the levels to which they're already having to combat issues with childhood obesity.
You're listening to the UAE's #1 talk radio station.
This is The Agenda with Georgia Tolley
On Dubai Eye 103.8.